Welcome to my channel, RX Sam 2020. Today we discuss a drug named Minoxidil. About Minoxidil is a medication used for the treatment of high blood pressure and pattern hair loss. It is an antihypertensive vasodilator. Low-dose oral minoxidil is used off-label against hair loss. Its effect in people with alopecia areata is unclear. Medical use. When used for hypertension, minoxidil is generally reserved for severe hypertension patients who cannot respond to at least 2 agents and a diuretic. Minoxidil is also typically administered with a loop diuretic to prevent sodium and potassium retention. It may also cause reflex tachycardia and thus is prescribed with a beta blocker. Minoxidil solution and foam are used to help hair growth in treating male pattern baldness. It is not used for baldness at the front of the scalp or receding hairline in men. The foam and 2% minoxidil solution are also used to help hair growth in women with thinning hair. This medication is not used for sudden patchy hair loss, unexplained hair loss. For example, if you have no family history of hair loss or hair loss after giving birth. Do not use this product if you are 18 years old or younger. What is pattern hair loss, also known as androgenetic alopecia, AGA, is a hair loss condition that primarily affects the top and front of the scalp. In male pattern hair loss, MPHL, the hair loss typically presents itself as either a receding front hairline, loss of hair on the crown, vertex, of the scalp, or a combination of both. Female pattern hair loss, FPHL, typically presents as a diffuse thinning of the hair across the entire scalp. Dosage. Oral. Severe hypertension unresponsive to slandered therapy. Adult, in conjunction with a beta blocker or methyldopa, and a diuretic. Initially, 2.5 to 5 mg daily, gradually increase at intervals of at least 3 days to 40 or 50 mg daily depending on response. The maximum dose is 100 mg daily. Give daily dose in 1 to 2 divided doses. For more rapid control of blood pressure, dose changes may be made every 6 hours with careful monitoring. Oral. Child, in conjunction with a beta blocker or methyldopa, and a diuretic. Less than 12 years, initially, 100 to 200 micrograms per kilogram daily, increase in increments of 100 to 200 micrograms per kilogram at intervals of at least 3 days, until BP is controlled. The maximum dose is 1 mg per kilogram or 50 mg daily. Elderly, in conjunction with a beta blocker or methyldopa, and a diuretic. Initially, 2.5 mg daily, increase gradually. Topical or cutaneous. Male pattern baldness. Adult, apply 1 ml of 2% or 5% solution to the scalp 2 times a day. Female pattern baldness. Female, apply 1 ml of 2% solution or 5% foam to affected areas of the scalp 2 times a day. Please note, 4 months of treatment may be required before hair regrowth starts. Continuous application is required to maintain hair regrowth. Contraindications. Hypersensitivity, pheochromocytoma, acute myocardial infarction, dissecting aortic aneurysm. Side effects. Topically applied minoxidil is generally well tolerated, But common side effects include itching of the eye, itching, redness or irritation at the treated area, and unwanted hair growth elsewhere on the body. Exacerbation of hair loss alopecia has been reported. Rare side effects are erectile dysfunction, depression, anxiety, decreased libido, and skin disorders. Alcohol and propylene glycol present in some topical preparations may dry the scalp, resulting in dandruff and contact dermatitis. Common side effects. Temporary hair loss is a common side effect of minoxidil treatment, a process referred to as shading. Acne at the site of the application. Burning of scalp. Facial hair growth. Inflammation or soreness at the root of the hair. Red-stained skin. Swelling of face. Drug interactions. Potentiate hypotensive effects with neuroleptics. Topical steroid. Retinoids. Synergistic effect with ACE inhibitors. Additive effect with clonidine and methyldopa. Special precautions. Monitor fluid and electrolyte balance and body weight. Pregnancy, lactation. Avoid eyes and other mucous membranes and broken skin. Apply only on the scalp. Significant renal dysfunction. Coronary artery disease. Recent myocardial infarction. Pulmonary hypertension. Angina pectoris. Chronic congestive heart failure. Frequently asked questions. Can minoxidil regrow hair? Although minoxidil can slow down and prevent hair loss, the amount of hair regrowth will vary. Minoxidil is not a cure for hair loss. Once a person stops using this treatment, the body will most likely shed any new hair. Who should not use minoxidil? This medication is not used for sudden patchy hair loss, unexplained hair loss. For example, if you have no family history of hair loss or hair loss after giving birth. Do not use this product if you are 18 years old or younger. What happens when you stop minoxidil? If you stop applying minoxidil to your scalp, you'll gradually lose any hair that you have regrown as a result of the medication. Minoxidil is a well-studied medication that's safe to use for the long term. What can I use instead of minoxidil? Neoxyl is an alternative to minoxidil and other hair growth lotions. Minoxidil has limited effectiveness and has many negative side effects. Neofolix lotion is 41% more effective than minoxidil on the growth of dermal papilla cells. It has 95% user satisfaction, according to research. What should you avoid when applying minoxidil? Do not shampoo your hair for 4 hours after applying minoxidil. Immediately after using this medicine, wash your hands to remove any medicine that may be on them. Do not use a hairdryer to dry the scalp after you apply the minoxidil solution. Blowing with a hairdryer on the scalp may make the treatment less effective. Brand names that are mostly prescribed by doctors. As tablet. Lonitab. Lonitin. Minoxidil. As solution, liquid, foam. Rogaine. Tugaine. Minoxidil. Mintop. Multigain. Mechanism of action. Direct stimulation of the hair follicles. Minoxidil may act as an epidermal growth factor on matrix cells, delaying their aging, thus prolonging the duration of the anagen phase via the activation of the beta-catenin pathway. Thanks for watching. Please subscribe and like this video.